Hello, my name is Britt Morales. I'm in Dr. Norton's clinical skills class at Hardin-Simmons University, and I'm going to be performing a newborn assessment. First, I would start out by washing my hands, and then next I would verify the patient's identity matched the mother's identity. So I would ask the mom to read off her ID band on her wrist, and then I would read off the ID number on the baby's wristband and make sure that they matched. I would then state the baby's name from the wristband and ask mom to verify. When the baby's born, we check an APGAR score at 1 and 5 minutes after birth. So this is where I would first start out by looking just at the baby's appearance. 0 points would be given to a blue or pale baby. 1 point is given to a baby with pink body but blue extremities. And then 2 points is given to a baby that is pink. So I would give this baby 2 points. Next, I would check pulses. And an absent pulse would get 0 points. Less than 100 beats per minute would get 1 point, and then over 100 beats per minute would get 2 points. So I'd give her 2 points. Next, I'm just going to look for grimace. So a floppy baby would get 0 points. Minimal response to stimulation would get 1 point, and then assuming this baby had prompt response to stimulation, I would give this baby 2 points. And then I would look for activity. So assuming this baby was active, I would give 2 points. But if there was just flexed arms and flexed legs, I would give 1 point. No activity would get 0 points. And at this time, I would also be checking and assessing for symmetrical movements to all extremities. Then last, for the APGAR score, I will check respiration. If the baby has a vigorous cry, then you give them 2 points. 1 point for slow or irregular respirations, and then absent respirations get 0 points. Next, I will check an axillary temperature. I would then get the baby's weight on a scale, and then I will check length of the baby and the baby's head. So this baby is 17 inches long, and then checking head circumference. Is about 11.5 inches. And now I'll check heart rate and respirations, and I'm going to count those for 60 seconds. So now I would do that for 60 seconds, and then I would document all of that on the growth chart and be sure to review it with the parent. Now I'll move on to the physical exam, so I'll remove the baby's clothing. I'm just going to start out by looking at the baby's head. I'm looking for caput, hematoma, and just filling the fontanelle, starting with the anterior fontanelle, filling the suture line, going to the posterior fontanelle. And then I'll look at the baby's eyes. The main thing I want to see for the baby's eyes is the red reflex. And the red reflex was visualized in both eyes. Now I will look at the skin color, looking also for rashes, just checking the texture of the skin. And then I want to look in the ears, just looking for mobility and making sure that there's a patent auditory canal. I will then check the nose and oropharynx, looking for moist mucous membranes and to ensure that the palate is intact. Now I'm looking at the thorax and the abdomen, checking for any masses, hernias, and now I will listen to the heart, lungs, and for abdominal sounds. For the heart, I want to be sure that I am checking for murmurs, respiratory sounds. I am checking for wheezing or crackles, checking the backside. While I'm checking the lungs on the posterior side, I am also looking at the back for any signs of spina bifida, and I don't see any. Now listening to the abdomen for vowel sounds, and it sounds good. And then now I will move on and remove the baby's diaper. And at this point, I want to check for any abnormalities in the labia or introitus, and she's a female. But if she's a male, I would look for abnormalities in the testicle or penis. And then for both sexes, I want to look for a patent anus. It is also important to document the first void and stool, therefore I would be checking that at this time as well. I will now perform the Barlow and Ortolani maneuvers, and this is checking for hip dysplasia. So I'm going to start out by checking the Barlow maneuver. So I place my thumb on the medial aspect of the legs and my fingers on the lateral aspect. Her knee should be in my palm, and really her knees would be bent. For the Barlow, I'm assessing for hip subluxation. Therefore, I adduct the leg and apply posterior force. And I'm doing this one leg at a time. And then now I'll perform the Ortolani, where I abduct the leg and apply medial force. And this baby is negative for hip dysplasia. And next I will move on and check reflexes. So first I will check the grasp reflex, where I place my fingers in her palms and she should grasp my fingers. The root reflex, where I place my finger next to her mouth and she should move her head to the side of the stimulus and start making a rooting or sucking motion. The Babinski reflex, I will stroke the bottom of her foot from lateral heel to the toes on the medial side, and looking for extension or dorsiflexion of the big toe and abduction or fanning of the other toes. I'll do that on both sides. For the Moro reflex, I will hold the baby supine and rapidly lower her, and her arm should abduct and then adduct. And then next we would move on to the procedures, and this includes a heel stick, placing ointment into her eyes, and cleaning the umbilicus and cord clamping. I would then go ahead and move on and dress the infant. And I would place a new diaper on her. And a new shirt. Now I'm going to swaddle her. And At this point, I would give her back to her mother to attempt to feed. And this is when I would receive a history from the parents, including type of delivery, how was the first feeding, ask if the parents had any concerns. I would move on to patient education, including asking questions about the car seat, making sure they have a car seat and know how to place the baby in one. I would inform them that the baby should sleep on her back, and I would offer any advice on feeding, and then again, just ask any questions that the parents may have. The last thing I would do would be to document this visit, including the first void in stool if there was one. And then lastly, I would just wash my hands, and then that concludes this video of neonatal assessment. Thank you.